What if I told you that the drink you've been consuming every morning for years, the one your doctor probably told you was good for your heart, the one marketed as natural, healthy, and anti-inflammatory, is silently inflaming your prostate tissue, triggering the exact cellular cascade that drives enlargement, worsens urinary symptoms, and accelerates the pathway toward prostate cancer? And what if I told you that when I started reviewing the dietary histories of my patients with the most severe BPH, the ones waking up 5, 6, 7 times per night, the ones with prostates measuring 70, 80, even 90 cubic centimeters, I found the same drink showing up over and over? Not in 30% of cases, not in 50%. In 78% of my worst cases, this drink was a daily habit. Hi, I'm Dr. Fernando Manocci. I'm a urologist who has spent over 20 years investigating the connection between diet, inflammation, and prostate disease. And what I discovered when I started analyzing not just what my patients ate, but specifically what they drank every single day, completely changed how I counsel men about prostate health. Because while everyone focuses on food, almost nobody looks at the inflammatory load hidden in beverages. In this video, we're going to cover 4 things. First, what this drink is, why it's marketed as healthy, and the specific compounds in it that trigger prostate inflammation at the cellular level. Second, the clinical and biochemical evidence that proves this connection with exact mechanisms, inflammatory markers, and prostate volume measurements. Third, the 3 other drinks that are almost as bad that millions of men consume daily without realizing they're feeding prostate enlargement. And fourth, what to drink instead, the specific beverages that reduce inflammation, shrink prostate tissue, and improve urinary symptoms with exact protocols and timelines. Could you take 2 seconds and subscribe? Because this type of information gets suppressed by industry interests, and the only way it reaches men who need it is through people like you sharing it. Now let's start with what this drink actually is, because I want to explain not just the name, but the biological reason why it's so damaging specifically to prostate tissue. The drink is orange juice, specifically commercial orange juice, whether it's fresh squeezed, not from concentrate, organic, or conventional. The problem isn't the oranges themselves, it's what happens when you extract the juice, remove the fiber, concentrate the sugars, and consume it in liquid form. Let me explain the mechanisms in detail, because this isn't just about sugar, it's about a specific type of sugar, consumed in a specific form. Mechanism number 1, fructose overload and inflammatory signaling. A standard 250 milliliter glass contains 20 to 24 grams of sugar. When you eat a whole orange, that sugar comes packaged with fiber that slows absorption. Your blood sugar rises gradually. When you drink orange juice, you're consuming the sugar of 3 to 4 oranges with 0 fiber. The fructose hits your liver in a concentrated bolus within 15 to 20 minutes. Your liver can only process about 25 to 30 grams of fructose per hour. Anything beyond that capacity gets converted to fat through a process called de novo lipogenesis. This is visceral fat, specifically hepatic fat that accumulates in and around your liver, and here's the connection to your prostate. Visceral fat is metabolically active. It produces inflammatory cytokines, specifically IL-6, TNF-alpha, and leptin. They reach your prostate tissue. A 2020 study showed that after 4 weeks of orange juice, serum IL-6 increased by 47%, TNF-alpha by 38%, CRP by 34%. Mechanism number 2, insulin spikes and IGF-1 elevation. The glucose component of orange juice causes rapid insulin release. A glass of orange juice can spike blood insulin to levels equivalent to eating 6 to 8 teaspoons of pure sugar. High insulin stimulates your liver to produce insulin-like growth factor 1, IGF-1. IGF-1 is a potent growth hormone. In prostate tissue, it's problematic. IGF-1 binds to receptors on prostate epithelial cells and signals them to divide and multiply. This is literally a growth signal. Data from the Physicians' Health Study involving over 14,000 men showed that those with the highest IGF-1 levels have 2.4 times higher risk of prostate cancer. Mechanism number 3, oxidative stress from concentrated citric acid. Orange juice has a pH of approximately 3.3 to 4.2, making it highly acidic. The prostatic urethra, the section of urethra that runs through your prostate, is exposed to acidic urine after you drink orange juice. Acidic environments increase the production of reactive oxygen species. These free radicals damage cellular DNA and trigger inflammatory responses. Mechanism number 4, displacement of anti-inflammatory beverages. This is the hidden cost nobody discusses. Most men have a relatively fixed daily fluid intake. If you're drinking 500 milliliters of orange juice, that's 500 milliliters you're not drinking of water, green tea, or other beverages with anti-inflammatory effects. Green tea contains EGCG that inhibits 5-alpha reductase. Men who drink 3 to 5 cups daily have prostates that are 20 to 30% smaller. When you choose orange juice over green tea, you're not just adding inflammatory load, you're removing protection. The net effect is exponentially worse. Now let me show you the clinical data that proves this connection is real. A 2019 study examined 240 men with mild to moderate BPH. Group 1 drank orange juice daily, Group 2 occasionally, Group 3 never consumed it. They were followed for 18 months. Group 1 showed average prostate growth of 18% over 18 months. Group 3 showed growth of only 4%. The difference was statistically significant. The most revealing finding, men from Group 1 who eliminated orange juice for 90 days showed a 12% reduction in prostate volume. The inflammation was reversible. Let me share a patient story. Richard, 64 years old, was waking up 4 times every night. His prostate measured 56 cubic centimeters. His IPSS score was 22. He drank 2 large glasses of fresh squeezed orange juice every morning. He'd been doing this for 15 years because his cardiologist told him it was healthy. After 90 days of eliminating it, his prostate shrunk from 56 to 48 cubic centimeters. His symptom score dropped from 22 to 14, simply by eliminating orange juice. Now, orange juice isn't the only culprit. There are 3 other drinks that are almost as damaging that millions of men consume without realizing the impact. Drink number 2, diet sodas and artificially sweetened beverages. The problem is the artificial sweeteners themselves, specifically aspartame and sucralose. Artificial sweeteners alter gut microbiome composition. They reduce populations of beneficial bacteria while increasing populations of inflammatory bacteria. This disruption creates leaky gut, allowing bacterial endotoxins like LPS to leak into systemic circulation, causing massive release of IL-6 and TNF-alpha. A study in Nature showed that men consuming diet sodas daily had 41% higher inflammatory markers. The artificial sweeteners were creating systemic inflammation. Additionally, artificial sweeteners irritate the bladder directly. Many men experience symptom improvement simply by eliminating diet sodas. Drink number 3, commercial fruit smoothies. These are marketed as health foods, but they are sugar bombs disguised as nutrition. 40 to 60 grams of sugar. You're drinking the equivalent of 10 to 15 teaspoons of sugar. The insulin spike and IGF-1 elevation are even more extreme than orange juice. When fruit is blended, the fiber is broken down into such small particles that it doesn't slow sugar absorption meaningfully. Your body processes it like straight juice. Drink number 4, low-fat or skim milk. The problem relates to concentrated hormone content and an imbalanced calcium to magnesium ratio. When you remove fat, you concentrate hormones like estrogens and IGF-1 in the remaining liquid. These fat-soluble hormones stay in the milk. Milk's calcium to magnesium ratio is 10.1. Your body needs closer to 2.1. Excess calcium without magnesium can calcify prostate tissue and worsen inflammation. Studies found that men consuming 2 or more servings of dairy per day had 60% higher risk of developing advanced prostate cancer. Now here's what to drink instead. Because eliminating inflammatory beverages is only half the equation, you need to replace them with support for prostate health. Replacement beverage number 1, green tea. Specifically 3 to 5 cups daily. It contains EGCG, a powerful catechin with multiple mechanisms. EGCG inhibits 5-alpha reductase, suppresses NF-kappa B, and induces apoptosis in abnormal cells. It even improves insulin sensitivity. Brew correctly. Use water at 70 to 80 degrees Celsius, steep for 2 to 3 minutes only. Drink it plain. Adding milk blocks the beneficial compounds. Replacement beverage number 2, pomegranate juice. It contains L-glutanins that convert into urolithin A with potent anti-inflammatory effects. The key is consuming it in small amounts, 60 to 120 milliliters per day, diluted with water to avoid the sugar load while getting the benefits. Replacement beverage number 3, water, but optimized. Front-load your hydration between 8 a.m. and 6 p.m. to minimize nighttime urination. Add a little lemon for flavonoids. Replacement beverage number 4, herbal teas like nettle root, pygium, and saw palmetto. These contribute to the overall anti-inflammatory load. Now, the complete beverage protocol for prostate shrinkage. Here's exactly what to drink and when for maximum anti-inflammatory effect. Morning 6 to 8 a.m., 500 milliliters of water with half a lemon. This rehydrates you after overnight fasting without sugar overload. Mid-morning, first cup of green tea. Noon, second cup. Afternoon, 1 liter of plain water, sipped gradually. Evening, third cup of green tea or nettle root tea, 60 milliliters of pomegranate juice diluted. After 7 p.m., zero fluids. Let me share Michael's transformation. He was drinking orange juice, Diet Coke, and smoothies. His prostate was 52 cubic centimeters. After 16 weeks of switching to the protocol, his prostate shrunk to 41 cubic centimeters, a 21% reduction. He was sleeping through the night completely. Now, the expected timeline. Week 1 to 2, symptom improvement begins as bladder irritation decreases. Week 3 to 4, inflammatory markers drop. Week 6 to 8, measurable prostate shrinkage begins. By week 12 to 16, most men see an 18 to 25% reduction in volume. I've been a urologist for over 20 years. Your prostate doesn't care about marketing claims. It responds to biochemical reality. Fructose creates inflammation. Stop drinking inflammation. Start drinking protection. The choice is yours. There's always a better option for your health. If this helped, please subscribe. In the next video, I'll reveal the single food that 90% of men with enlarged prostates eat daily. Comment below what you were drinking before. Stop inflaming your prostate. Start protecting it. I'll see you in the next one.